Hello friends, welcome to our YouTube channel SLP Sanjay Kumar Voice Therapist. Today on 10th March 2021, we are live and with Mahir. And Mahir is having some voice problem. And in the future, we are going to be post-treatment live also. So please subscribe our YouTube channel and don't forget to watch this post-treatment live. Mahir, I want some example. Say about yourself and your problem. Why you contacted us.
Hi, my name is Mahir. I have been facing this voice problem from the time when I was 12. It first started when I caught a bit of cold and I kept shouting and shouting. And afterwards, when the cold went away, my voice had cracked. When I had cold, my voice had cracked, but when I recovered from it, that voice remained as it is, and that's it. That is when it all started.
Okay, so we'll do the needful, and those who are watching this live, let me introduce myself also for them. My name is Sanjay Kumar, by profession.
I cannot hear you.
Yeah, sorry. Yeah, so my name is Sanjay Kumar. I will introduce myself also. My name is Sanjay Kumar. By profession, I'm speech language pathologist and audiologist, and my area of interest is treating voice disorder. And I have done my graduation from AIIMS Delhi, All Indian Institute of Medical Science, New Delhi, and I have done my post-graduation from the University of Mysore in the field of speech language pathology. So I treat communication disorder. I provide voice therapy. I do audiological services also. I provide audiological services, hearing evaluation, hearing at dispensing, hearing at trial, and all those things. But of course, my area of interest is treating voice disorder. So मैं बताना चाहूँगा हिंदी में भी कि जो लोग भी लाइव को देख रहे हैं, हमारे साथ माहिर हैं और इनको वॉइस की समस्या है. आज हम लोग ट्रीटमेंट से पहले लाइव हो रहे हैं और आज डेट है 10th मार्च 2021. आज हम लोग ट्रीटमेंट से पहले लाइव है और भविष्य में हम लोग ट्रीटमेंट के बाद भी लाइव होंगे. तो आप लोग हमारा यूट्यूब चैनल को सब्सक्राइब कीजिए और इनका पोस्ट ट्रीटमेंट लाइव देखने की ज़रूर कोशिश कीजिए, आप भूलिएगा नहीं. और मैं थोड़ा सा और भी एक चीज़ बता देना चाहूँगा लोगों को. इस लाइव से जुड़े रहिए. हमारे क्लिनिक में क्या क्या सर्विसेज अवेलेबल है उसके बारे में मैं एक शॉर्ट में वीडियो दिखाऊंगा. लगभग जो है कुछ ही मिनट का होगा. उससे पता चलेगा कि ट्रीटमेंट से पहले वॉइस कैसी थी और ट्रीटमेंट के बाद कैसी होगी. सिर्फ एक प्रॉब्लम का नहीं, बहुत सारे कम्युनिकेशन डिसऑर्डर जिनकी सर्विसेज हमारे क्लिनिक में अवेलेबल हैं. तो अभी मैं वो भी एक बार दिखा देता हूँ, वो वाला वीडियो. जस्ट अवेयरनेस के लिए मैं ये दिखाना चाहूँगा. वो थोड़ी देर के लिए है, तो आप लोग ये देखिए, लास्ट तक आप लोग देखिएगा.
I'm 22 years old. I'm from the UK. I like to do boxing.
Hello, I'm Roshan. I'm 22 and I'm from London, UK.
After surgery, I have vocal cord paralysis. YouTube video of Dr. Sanjay.
You try if it's coming or not, doesn't matter. You try.
3 weeks back, I suddenly woke up and I could not speak.
ये स्टमिंग की प्रॉब्लम है और ये प्रॉब्लम मुझे 7 ईयर से सर मैं यहाँ पे और ट्रीटमेंट के बाद आई फील समथिंग कंफर्ट देन बिफोर.
My name is Manas Lakshmi. I'm from Ahmedabad, Gujarat. I found your videos on YouTube. I was looking for cure for puberphonia.
I'm Manas from Ahmedabad, Gujarat, and I came here 8 days ago for speech therapy, and obviously I'm really happy with my treatment.
मैं ऑडियोलॉजिस्ट सर गले की आवाज पुबरफोनिया है मुझे।
मैं यूपी से हूँ सर, मुझे 9 साल से पुबरफोनिया था।
Okay, my name is Kevin. I'm from London, UK. Suffering from puberphonia, so I decided to come to Bangalore and meet Dr. Sanjay Kumar together.
I actually had this surgery a month back, and I'm really happy about it.
Thank you for coming here and showing faith. Just you try to say something, counting 1 to 10. You can try 1, 2, 3, something. Okay. Up to 10 you can try.
It's been 3 months. The last 2 months, I had like hoarse sound, and then 1 month completely changed. No any sound.
I contacted Mr. Sanjay Kumar, speech language pathologist in India, and he agreed to work with Cyrus, and the treatment has been very effective, and we're very happy with the result. His voice is now much stronger, deeper, louder, and there's a big improvement.
Yeah, so that was just a kind of trailer to understand how a certified speech language pathologist changes the life of people having a different communication disorder. And now we'll come and we'll continue the conversation with Mahir. So Mahir, tell about your problem again, why you contacted me. Mahir, switch on your mic.
Okay, can you hear me?
Yeah.
Okay, so my problem started when I was 12 years old. So at that time, I had a normal voice, and after that, my voice broke, and I had a bit of cold. And afterwards, when the cold got cured, but my voice remained as it is. So from that point, at that time, I had a very high pitch voice, like higher than what I have now. But as you can see, it's still not normal. So I did not know that this problem has a cure. I contacted doctors before, and he told me that it will get cured automatically when I will be 21 or 22. But deep down, I knew that something is wrong, and that can be fixed. But just before 2 weeks ago, I just Googled that high-pitched voice or female voices in males, and I got to see your videos. There are hundreds of customer testimonials. I viewed those, and I got hopes again that this will be cured. So this is the way I got to know about your treatment.
Okay. Thanks for your faith on us, and we'll do the needful. And slightly awareness is less, so with the time to time I will be making live of my patient before treatment and after treatment, so that people should get motivation, they should get hope, and they should understand about the problem and related to the speech and hearing, and even like how a certified speech pathologist changes the life of people. So just before you, I was playing one video where we combined just different communication disorder and before after, so that people get an idea. So that was a kind of trailer in between this live. And I will also talk about why this problem occurs, such kind of problem. And the reason of high-pitched voice, or we can say feminine voice, can be so many in case of male. Like it can be due to some hormonal issue, we say testosterone hormones. It can be due to the sulcus vocalis, nature has not given sufficient mass in the length of the vocal cord, due to the phonatory gap, due to the muscle tension dysphonia, and sometimes due to during the puberty, mass and the length of the vocal cord changes and the patient will not accept the new voice actually, which is low pitch, and so that's why also it happens. So I did some acoustic analysis, I did some perceptual evaluation, and with the other information, the problem what you are having, I'm going to talk in more details. So those who are here, they may be connected with us. Now I'll be explaining the reason. So to understand the problem, let's first understand how the normal speech production mechanism is. So once you know the normal speech production mechanism, it will be easier for you to understand why the problem is. For normal speech production, first thing is the thoughts that comes in the brain. Then we take air, that air goes to the lungs. When we breathe out, we put the air pressure below the vocal cord. Here we have larynx. Inside the larynx, we have two string-like structures known as vocal cords. So once you put air pressure below the vocal cords start moving like a string of a violin and guitar, and sounds will generate. Then we modify that sound into different sound with the help of our articulators like lips, tongue, jaw, tip, palate. These are known as articulators. They help us to produce the specific sound. For example, if you want to say p, lips are coming closer together and touching each other. When you want to say t, tongue is coming between the teeth. When you want to say k, back of the tongue is getting elevated and touching the soft palate. So each and every sound has its own place, own manner of articulation. When you say one sentence, so many things happen at a time. Thoughts come, we take breath, we put air pressure below the vocal cord moves, sound generate, we modify that sound into different sound, one after another. In one sentence, there are so many words. In each word, there are so many sounds. Each sound has its own place, own manner of articulation. So in this process, there are hundreds of our body muscles works in a very, very coordinated way. If coordination among these muscles goes, fluency goes. So that will be seen in the case of a stammering, stuttering. Hindi mein bolte hain haklaane ki jab samasya hoti hai. Something lagging the coordination among the speech production muscles of the brain. If there is something wrong in the place of articulation, manner of articulation, for example, if you want to say t, tongue should come between the teeth. T is a dental sound. But if you are putting your tongue in somewhere else, the pronunciation problem will happen. And when there's something lagging the coordination among the speech production muscles with the brain, then there will be a stammering, what I told earlier. And sometimes what happens due to some infection, during the surgery, the nerve which supply to the vocal cord, that will get damaged. So there will be vocal cord paralysis or sometimes vocal cord palsy. In that case, the voice will be breathy, very soft, and we can say kind of dysphonia will be there. So for that also provide the voice therapy. And let's discuss about your case and the people like you. But I just try to understand all the high-pitched voice are not exactly the same. There can be symptom like a fever. If a fever is there, for a normal person, it's a fever. But for a physician, it can be viral infection, it can be bacterial infection, it can be some other reason. So for me, pitch is high. So I'll be thinking what could be the reason based on that we'll providing the treatment. But for a normal person, it's just a feminine voice and high pitch voice. They will think. But for different situation, the way of treatment will be different. So I'm just discussing about your situation. So during puberty, what will happen? Mass and the length of the vocal cord will increase due to a hormone called testosterone. If mass of the vocal cord will increase, length of the vocal cord will increase. Here we have larynx. Inside the larynx, we have two string-like structures known as vocal cords. So if mass of the vocal cord, length of the vocal cord increase, pitch will reduce. So before puberty, there is no much difference between boy and the girl's voice, boys and the girl's voice. But after puberty, the voice has become more masculine and low pitch. Due to the hormone testosterone, the mass and the length of the vocal cord increases. If you have seen the guitar, in the guitar, thin string produces high pitch voice. Thick string produces low pitch voice. So before puberty, the vocal cord is like a thin string of a guitar. But after puberty, it becomes thick string of guitar. So thick string means low pitch voice. So So ideally, at this age, 21 years of age, your voice should be low pitch, but you are still speaking in a high pitch. The reason could be because from childhood to puberty, you spoke in a high pitch voice, and during puberty, your mass and the length of the vocal cord changed. So now you should produce low pitch voice. But because of so many years habit, you have not accepted the change, and still you are using your childish voice. So suppose if this is your vocal cord, so it may be normal, but because of your childhood habit, you want to produce the childish voice, high pitch voice. So you are not vibrating your whole vocal cord mass in an effective manner. You are vibrating only thin edges of the vocal cord. So if thin edges of the vocal cord is vibrating, the vocal cord, which is actually a thick string, but behaving like a thin string. So if I will stimulate whole mass and the whole length of the vocal cord, so vibrating mass and vibrating length of the vocal cord will increase, and the vocal cord will start behaving like a thick string of a guitar, and guitar string is thick, the pitch will be lower. So this is the biophysics behind the problem. So in my voice therapy, I will be stimulating your whole mass and the whole length of the vocal cord to vibrate in an effective manner. So sometimes people say that some patient will say, I want more low pitch, I want little moderate high pitch. So actually I will not be working on the pitch, to be very frank. I will be working to stimulate your vocal cord mass in such a way that it should vibrate in a more effective manner. So the final voice will be depending on the kind of vocal cord mass it has. So of course voice sound is coming. Can you mute your mic? Mic, you can mute your mic.
I can hear you.
Yeah, can you mute your mic? Yeah.
Okay.
So I'll be not be replacing the vocal cords or larynx. What vocal cord, what larynx you have, depending upon that, I'll be giving training to use in a more effective manner. So what I do in my speech therapy and voice therapy. So that's why the person-to-person therapy result vary, because what kind of mass and the length of the vocal cord has been given by the nature, that also matter during the treatment result. So those who are watching this live, my suggestion is that try to watch as many videos you can, so you'll get better idea like what changes you can expect if you take treatment from us. And two questions are very common, what I get in comment box and different places. How much will be the cost and how long it will take the treatment? So cost will depend. After doing the perceptual evaluation, we will be able to guide. And the duration also, once you do the perceptual evaluation and sometimes acoustic analysis, sometimes certain tests will recommend. After combining all the information, we'll be able to comment on the cost as well as duration of treatment. And one more question I get on my comment box, what is your contact details? So you can go to our website, speechtherapyindia.in, and click the reach me. You will find our contact details. You'll find email ID or phone number, and in the Google map where the clinic is established, that also you will be able to find. So thank you everyone for joining us and watching us. I want to thank you everyone. Saurya, thank you. And Preetham, thank you so much. Preetham is saying, I also need the treatment. Thank you, Preetham. And Shaurya is telling, I need treatment. So you can click our website, speechtherapyindia.in, and then you can click reach me. You will find our contact details. Call us for perceptual evaluation. After the perceptual evaluation, we will be able to comment on the problem. We'll be able to help you by offline or online, and what will be the treatment duration, what will be the treatment cost. So feel free to call us, mail us, reach us. Thank you everyone for joining us. Thank you, Mahir, for being live. And of course, it is going to help many patients once they will watch your post-treatment live. Thank you. So we'll stop this live now. So Mahir, we are going to stop this live now. Okay. Thank you.
Okay.